everyone, and welcome back to my podcast. Today we have a very special guest on the show, Lori Zimmerman.
Hello.
I invited my friend here today just to chat and give an unbiased look at issues presented throughout our healthcare system. And, while there are definitely a plethora of issues to look at, today I wanted to focus on staffing issues and insurances.
Insurance.
Tell me about it. And, historically, there have been staffing issues nationwide in all kinds of occupations, fast food, the office, everywhere you look. But today I wanted to focus on the chronic understaffing represented in our healthcare in places like skilled nursing facilities, hospitals, urgent cares, etc. Throughout time, staffing issues has been a very non-linear notion. It doesn't start off bad, gets good, and stays good. It's very up and down, up and down. You can observe understaffing during times like the Great Depression or the recession that we had in 2008. And in recent years, I want to say that the biggest contributor to low staffing numbers would be COVID. When the pandemic started, there was such a massive increase in patient acuity. A lot of the empty units in hospitals were used as overflow for all the COVID patients that were coming in. And with such a surge in that patient load, the number of staff is staying the same. So you can imagine that the burnout rate for nurses increased greatly, and a lot of people in healthcare left the field in general and just hasn't come back.
Yeah, that was a horrible, horrible time to have to live through, and I never, ever want to see it again. In fact, just saying COVID makes me want to choke a little bit. But anyway, putting COVID aside, there are a lot of other factors to look at that affect the number of staff in hospitals or other places of care facilities. Things like the aging population. Many healthcare workers, including nurses, physicians, and other professionals, belong to the baby boomer generation. As they retire, there is a significant loss of experienced personnel that is challenging to replace quickly. Mm-hmm. Kids, they think they want to be a nurse until they have to change the first diaper or bedpan.
It's a field not a lot of people think about.
Or honestly, you have personal experience in this, patient abuse.
A lot of things that
crazy stuff happens. Yeah. So it's a little more challenging than they anticipated. They want something cleaner and easier. Another thing to consider is the education to become a nurse or a healthcare professional. Not a lot of people have access to pay for schooling or don't know any resources to help them pay or enroll in school. It's a lengthy process, and if your heart's not in it, like teachers,
Mm-hmm. Yeah, you got to be
you got to want to do it
for the right reasons. Yep, definitely. And, those classes that are, quote unquote, weed out classes are definitely weeding out the people.
They're weeding them out.
The harder classes, yep. And it really is such a complex issue to analyze and comprehend. And let me throw some numbers at you here for a second. Did according to a recent study by the American Hospital Association, that nearly 31% of hospitals reported to the federal government that they were anticipating critical staffing shortage.
Wow.
And in that same study, it was found that 35.8% of hospitals reported a nurse vacancy rate greater than 10%, which is actually up 23.7% prior to the pandemic. Data from the Bureau of Labor Statistics also states that hospital employment is down 95,600 employees from February 2020. Yeah. So when you hear those percentages, it sounds like such a low number, but in reality, we're talking about tens of thousands of people.
Hearing those numbers out loud really makes you see the severity of staffing issues. And at the same time, you can see that this is a problem, but how does understaffing affect other individuals? Aside from it affecting the mental health of healthcare workers, it's also affecting the patients and their satisfaction. Mm-hmm. Understaffing leads to things like decreased quality of care, delayed response times, medication errors, patient falls or injuries. There's a lack of communication between staff and patients, and even higher rate of a person being readmitted to the hospital.
Mm-hmm. And I definitely agree with you on all those points. And really, the only resource I can think of that would help these staffing issues would just be hiring agency nurses. It's an easy fix, but that's really only a temporary solution, and it ultimately leads to no progression whatsoever. Right. I think things like having mandated patient ratios or pay increase incentives would definitely encourage people to get back into the profession.
Oh, I definitely agree. There's more to it than just pay. You know, you can, I mean, and how feasible is it to be a travel nurse?
Yeah.
You know, if you're young, you're single, you don't have children, no family, you know, like it could be kind of exciting and you're making more money, but that's not sustainable.
And after a while, people want that stability as a staff nurse.
Roots, you know, you want the benefits, you want to be appreciated and feel part of the team. It's hard to continue to just relearn an institution. So that's got to be burnout too.
Yeah.
You know, I think right now a lot of people are chasing money, but that's not an answer.
We need more things to incentivize higher,
they're going to find out the hard way.
Yeah. And while I could definitely sit here all day and discuss our first issue, I definitely want to shift on over to focusing on our next healthcare related issue, which would be health insurances. Dun, dun, dun.
Oh, I hate health insurance.
You know, there are so many aspects to focus on with this one. And really the two main ones I see often are what do health insurances cover, you know, in general or during a hospital stay. And really what happens when a person doesn't have health insurance at all.
Well, and I agree, and this is definitely something that affects everyone, even me. And I meet people every day. I feel like I constantly just educate people on how insurance works. You know, every time I get a new employee, a young one, like most recently, I just had a very young employee start with me, and we do not offer health insurance for a small business. So I was explaining the marketplace to her. Well, she was like, wow, I have to do all that?
Yeah, not a lot of people know. Yeah.
And it's confusing, and I'm constantly counseling people on how it works, what deductibles are, what are co-pays, you know. But, you know, it affects everybody. I mean, back in my day when I was 18, I'm old, by the way, I was expected to be completely on my own. And the biggest issue I faced was getting health insurance. Maybe not the biggest one, but it was pretty big. It took me so long to be eligible for it at my job. Like one time I went long periods of time without having any health insurance. This one time I got an ingrown toenail. And the process to treat that and heal it up in total cost me $700 for an ingrown toenail. But I didn't have a choice.
Yeah.
They hurt. For a while, I was so scared to get sick in any way because I simply couldn't afford the cost of any treatment. Even a simple urgent care visit was, you know, $200 without insurance.
Yeah.
And that was just to be seen. Not to mention the medications that we were getting, you know, like, while there are other resources for people like Medicaid, a lot of people, including me at the time, couldn't qualify for it. In the eyes of the state, I had a high enough salary that I didn't need it. Even though I was living paycheck to paycheck, there are places like free and low-cost clinics. However, the treatment you get there just doesn't compare to a place that takes private insurance. For the most part, I felt like I had to handle it on my own.
Yeah, and I'm sorry you had to go through that. And even hearing your story, I can imagine there are millions of others who experience the same thing, unfortunately. You know, according to the U.S. Department of Human and Health Services, in 2023, about 7.9% of people don't have health insurance at all. And like I said earlier, it sounds like such a low number, but to put that into perspective, it's around 30 million people in the U.S. that don't have health insurance. And to look at the people who do have health insurance, a lot of companies don't even cover medications or procedures a person needs because it's not deemed, you know, quote unquote, not medically necessary.
Oh, don't get me started on medically necessary. Like,
you know,
who are you?
things like insulin most of the time aren't even covered, and that's a life or death kind of medication as well. Like, and really another thing to consider is, you know, a person's deductible rate. You know, some people's rates are so high on their deductibles, you know, you have to spend so much money before the insurance even kicks in. And looking at those prices, they only keep getting higher with the inflation rates, and wages are staying the same.
Oh, and hearing all this information, it really makes me wonder how many people have had to file for bankruptcy due to medical debts, especially in our older population. I mean, some of these plans, like the bronze plan, the deductible was $7,481 for a bronze plan. $48.90 for silver, $16.50 for gold plan.
And that's not even considering the money you pay for the insurance.
The premium.
Yeah.
Right. I mean, at one point I was paying $700 a month for a $4,000 deductible insurance. And I was making about $45,000 a year.
Yeah, so
that's a lot.
The math doesn't add up there.
That's a lot of money. And you know, that was the year that I needed to have a major surgery. And I ended up paying, between my deductible, the premium, and the 20% copay, I had to raid my 401k to borrow $10,000 so I could pay the hospital bill.
And I can imagine, even just your story, this is definitely a thing that millions of Americans have to go through.
Yeah, medical bankruptcy is a real thing.
Yep. And it's very absurd to think about all of these topics, but unfortunately we are all out of time here today. And I would like to thank our special guests for being here today to discuss these topics that, not many people talk about enough. Tune in next week to hear more information about our healthcare systems, and thank you for tuning in.